word on the street is that the issue here is that in a lot of ways, there aren't high quality jobs. There aren't
that's
high
all
paying
we
jobs.
have. Mostly all that we have are these retail part-time jobs here. So most people are making minimum wage or just a little bit higher than minimum wage. And I got to say too, because there's always this perception that people who make minimum wage are lazy.
I'm here to tell you that's not the
They
truth.
work harder than anybody. Let me tell you, those are the ones that are doing the hard work to support
not
everything.
A lot of money.
Right.
And oftentimes are going from one
like
low-wage part-time job to go to the next low-wage. I'm telling you, trust, I can tell you stories.
Yes.
I can tell you stories. And then talking about, and then I also, I got to go down this route real quick before I get back to the pathways and why it's problematic and everything else. You have people who have employers that are, I'm going to say the word, but they were basically like messing with people's situations. Okay. I didn't really, okay, maybe not choice of words, but it's just what came to my spirit.
Hey, listen, say it like you mean it.
But you had people who were working an 8-hour shift, coming home, but then they had to report back within less than a 24-hour period. Now I'm doing the math real quick. And I'm asking them, is that even legal for your employer to do that? Because you're basically reporting a double here, go home for a few hours, and then you have to report back like by that next morning.
With no rest.
Yeah. So again, we have so many on multiple layers, and that's not even healthy.
Not to mention, we know these programs that are offered by the government have the worst administration. They're like, they take forever. They don't answer the phone. They lose information. We know these things for a fact. And so to put this Pathways program in this kind of Republican atmosphere where they're trying to hold people accountable to turning in all these documents and making sure they get there on time, it just seems like it's going to be disastrous.
It's just destined to fail.
It just does. And so on that note, because I got to mention this too because it's so critical, is the Medicaid unwinding.
That's exactly where I was going to.
We're all there.
Exactly.
And so this is another something that's going to be colossal. Because again, the systems that we have to provide these things, they're broken. They really are broken. And so tell folks, what is Medicaid unwinding? And why is this going to be just devastating if we don't get the word out?
Sure thing. So basically, Medicaid is, of course, a government insurance program that's available based on your finances, based on your, economics. So what happened when a public health crisis was during COVID,
right.
Medicaid was expanded out to cover a broader number of people.
People who were affected by COVID.
Who were affected by COVID. So as a public policy, the United States of America said, okay, well, we're going to have to broaden the umbrella of people who would be able to be covered by Medicaid. For example, if you were just above the threshold pre-COVID, you would not have been able to be eligible for Medicaid.
Right.
But because it was a public health emergency and Medicaid was expanded to cover those that would have fallen in the gap. You make too much to be on Medicaid, but you don't make enough to have quality health insurance. So you're kind of in that, I'm going to not have health insurance. And then if I have to get sick, I'll just have to do whatever I got to do.
Right.
That was covered, an umbrella, during COVID.
Okay.
Now, since COVID as a public health crisis has not, it's been... It's ending.
It's ceased.
It's done.
It's not over. We're still out there. It's never going to go away.
Now, we're talking from the policy standpoint. From a policy standpoint, COVID is over. From a reality standpoint, it's really not.
Right.
But since the policy is that COVID is over, therefore, people who were in that, hey, you got a little extra coverage,
they're going to end.
You're going to not. Basically, the rule will be returning to, if this is the eligibility amount, it didn't matter if you were able to be covered under Medicaid during the COVID crisis. Now, that coverage that you used to have is coming. So if you were in that gap between I'm eligible for Medicaid and I'm not, now you're kind of in that little gray area, you're going to be uncovered. Okay?
And so not only will you not have coverage, but I know they're shifting over and now they're making anyone and everyone that has Medicaid, you're going to have to re-enroll.
Get your information updated, because If not, then you'll be left in a gap of I don't have it, where you might have thought that you did.
And they will drop your insurance.
They will drop.
And so for a lot of people, like elderly people who just
have multiple jobs and don't really have a lot of time to just sit down and deal with.
So we really got to get the word out,
yes.
because those people are in danger. And I think this starts April 1st.
Yes.
And
Please.
It's going to last for I think they said about 12 to 16 months.
Yeah,
but every state gets to choose.
Now every state gets to choose. Now here's the thing: the federal policy is 16 months.
Okay.
However, Georgia has decided we're going to try to make it get done in 12. So therefore, the clock is starting. So please begin to make the calls. Because we know there can be a little administrative time situation going on with how do I get my information in. So we're going to get more information out there about how to do this. Getting re-enrolled. Having your information updated. That's huge. Because Medicaid expansion, I just have to add this too, as my shameless plug. Mm-hmm. If Medicaid was expanded the way it actually is being done in many states,
once again, Georgia's behind.
I'm gonna sip my mango lemonade because it actually is good. I'm just saying.
I know y'all heard the lip pop. That's how we do it in the South. I love it.
Just saying. If people are, where was I going with this? I'm so sorry. But basically, making sure that we are getting expanded Medicaid, it actually is more cost effective. I'm going to talk in the camera on this one. I love you. I'm talking to the camera on this one. I'm going to tell the people. When we're talking about administrative, when we're talking about policy, it is actually more cost effective to have this population covered by Medicaid than to deal with the medical crisis of not having Medicaid expanded. I don't know if I'm going to make that clear enough, but it is, if you are a numbers person, a budget person, let's get to the bottom line, to which is more cost effective, kind of person, I am too.
So this doesn't really benefit the state to not expand.
It is a win-win to have expanded Medicaid expansion. It is a win-win for the population. We know that people are still recovering. People are still trying to get caught up on rent. People are still trying to manage life because of the effects of COVID and how people have lost jobs, lost loved ones, people who have lost their homes, people who have passed away, providers.
So that was like a loss of income in the household, right?
We can go on with this forever. Right. But the point is that from a policy standpoint, which is again part of what SOWEGA Rising partners with other organizations to do, is to amplify the voices and to say, listen, legislators who might not have any conception of what it's like to be on the edge. Because you're good, you're paid, you're handling your business. You don't think about it. Because you got government and you got insurance anyway. So what we're doing is to advocate for people to make sure that we say this is important, it is cost effective, and it benefits Georgia. People won't want to bring industry to Georgia if they feel like the health insurance is nonsensical. Right. So finally, look, before I completely forget this one, the last area of listening sessions that we have to have is on maternal health.
And we're going to bring you back for that. Okay. We can talk. That's a whole
other show. Okay.
Right?
It is.
But I think there's two big takeaways from today. Mm-hmm. Number one, we need folks to be talking about Medicaid unwinding. We need our churches, our community leaders, our organizations, our government people, talk to everybody about Medicaid unwinding because we don't need folks to lose their coverage. That's it. And so that's the first thing. Second thing is, they got some stories to tell. We know you do. We know y'all got stories.
I know you do.
Because there's things happening in this community around medical debt, around treatment of people, especially Black people, in the medical system. And we want to hear it. Like, we don't want to, we're not dismissing you. We want to hear your story. Listen. Because you've been dismissed already. And so we're giving space for you to come and tell your stories to this lady.
This is 2023. We're not doing this fading off into the distance anymore. No.
We're going to scream it loud because we got something. Sal's got something to say, y'all. And she's going to give you the platform to say it.
Listen, we got to do this.
This
is not optional.
Thank you so much for coming on our show today. And we're going to have you back later to talk about Black maternal health because there's some really good stuff we need to talk about and how it was actually birthed here in Albany.
Love it. Yes.
Pun intended. So thank you, Alysia, so much. You're going to see her again on the New South is Rising podcast. That is our show for today. You all have some things to do, and that is like and share this post. Make sure that you tag people in this post as well.
Please tag providers. Yes. Tag people who you know have a story to tell. Please tag people who you feel like would be beneficial to partner with. Please tag people who have a vested interest in human beings. Because like we started off the show,
It's about
we're human
humanity.
beings, and empathy and health affects every aspect of everything.
There it is.
That's it.
Subscribe
It's
to
all
the
connected.
show. Thank y'all for tuning in to the show today. And we'll see you all back on the South is Rising podcast. And don't forget to listen to my shade of this. Thanks for being here.